Live. I'm so excited that you're here. And today we're going to be talking about cancer and how to make your body an unwelcome place for cancer. Everyone is affected by cancer in one way or the other, either personally or someone that they know or love. And it's scary. I mean, I have patients who are worried about getting cancer or patients who have had cancer and really worried about the recurrence of it coming back. Some patients may have the genetic predisposition for it and they're really nervous about, am I going to get cancer? And so no matter where you land on this spectrum, whether you've had it, have someone, know someone who has it, or are concerned about getting it, this talk is for you. Today's talk is about understanding that there are certain lifestyle changes that can be made to lower your risk of getting cancer. And if you already have or had cancer, there are some changes that can help minimize the risk of the cancer recurring. Now, notice that I said minimize the risk. I didn't say I have the cure for cancer or that I can guarantee prevention. I just said minimize the risk because the name of the game is minimizing risk, right? That's why we wear a seatbelt. We wear a seatbelt because we are less likely to die in a car crash if we wear a seatbelt. Does that completely, remove the risk? No, of course not. There are still fatal crashes even with seatbelts, but it's about minimizing the risk. Think about people who smoke. If you don't smoke, you are less likely to have lung cancer, right? But that doesn't mean that people who don't smoke are never going to get lung cancer. So I really just want to take a moment before we dive in to talk about the fact that this is about minimizing your risk for cancer, not anything outlandish or, cure that I'm saying to a guaranteed way to cure or prevent. That's really important that we're clear on that. And so that we get the right focus for this talk. And everything I talk about in all of my lives is really about reducing the risk of disease and increasing the possibility of not just living longer, but living healthier longer. So today I'm going to show you the things that you can do to help minimize the risk of getting cancer. Anywhere on any platform, if you type the word change anywhere, then that will let us know that you want the show notes and we will reach out to you. If you're watching this on YouTube, then of course, like this and subscribe. Don't forget to subscribe. If you're listening to the podcast, then all you're missing is that today I always wear my red stethoscope that my wife gave me. And today I'm wearing a black sweatshirt. But other than that, I look exactly the same as I always do. And all these platforms, if you're not following us on Instagram, what are you waiting for? It's time, because we're super funny on Instagram and we're a little bit informative, but mostly funny. And no matter where you are, share this with the people that you love. Share this with the people that you think it will help and let them become the game changers in their life. And if you don't know by now, my name is Efrat Lamandre. Everyone calls me E or Dr. E, whatever works for you. And I invented the new method where we empower people to realize that their symptoms are not in their head and help them become the game changers in their life. And if you don't already know, I also wrote a book called It's Not in Your Head, and it's available on Amazon. I may or may not be an Amazon bestseller. You'll figure that part out. So whatever platform you're on, join the conversation. Let us know that you're here. Even if it's not during the live, we really check these messages and we love it. So let's jump right in. Let's jump into this topic of cancer, this really serious topic. It's the second most common cause of death throughout the world. Cardiovascular is the first. This is the second. And while, of course, there's been amazing medical advances in recent years, we're still likely to see over 20 million new cases by 2025. That's like tomorrow, okay? 20 million new cases. One of the major shifts that we've had over the past few decades is understanding that there are things that we can do in our lifestyle to minimize the risk of cancer. Decades ago, this wasn't a conversation. You just kind of got cancer out of the blue, like lightning strike. But we're understanding more and more that our lifestyle really affects our risk for cancer. And functional medicine, which is what we do at the new method, is looking at the root cause and looking to see what kind of imbalances your body's going on in your body that's allowing the cancer to grow. And if we look at that, we can start thinking of ways to reduce the cancer. And of course, if you're already dealing with cancer, You should be using all the treatments that conventional medicine have. I want to make sure that that's really clear. You should be listening to your oncologist, using all the conventional medicine approaches, whatever they're recommending, whether it's chemo or radiation, whatever is there. But what you want to consider is adding functional medicine approach to this. Let me just put this up here on my screen. You want to add a functional medicine approach, not instead of, you want to add it and create a true integrative approach where you have the conventional modalities and the functional lifestyle approach. And together that creates the most powerful integrative approach to this disease as well as others. Because conventional medicine, as you all know, has made huge strides in how it treats cancer. So please be sure to do whatever your oncologist recommends. But conventional medicine doesn't recognize the importance of diet and lifestyle, which is what we're going to talk about. And putting these two worlds together is the most powerful thing possible. So whether we're talking about preventing cancer or preventing recurrence, it's really important to talk about how to make the body a place that's not friendly for cancer to grow. Because at this point, more than 70% of cancers are caused by lifestyle factors that compromise the immune system, 70%. So whether it comes to treating cancer or other chronic diseases, I think if you watched my lives by now, you will know that what we need to talk about is stopping inflammation and strengthening your immune system. So how do we do that? How do we stop inflammation and how do we strengthen the immune system? These are really fancy words, but give me what I can do, E, and that's what I'm going to talk about. So we're going to talk about stress, movement, nutrition, and the supplements that you need to help reduce the risk of cancer. And I'm going to start with stress, which I don't usually do. I usually start with nutrition, but over time, I've come to appreciate that people put stress last on the list. They're willing to fast and change the food they're eating and taking the supplements, and we will get to that, of course. But stress, they deal with it last. And a lot of people think, well, it can't really be that important. How important is the stress? You know, everybody has stress. And I want to talk about it first because you have to remove the stress if you want the rest of this to work. Stress is linked to so many diseases, not just cancer, so many diseases. Now, we're not talking about short-term stress, like before an exam or how stressed I am 5 minutes before I do these lives. We're not talking about short-term stress. That's appropriate. It has a beginning and an end. But we're talking about this chronic kind of no end in sight stress. That's a kind of stress that will weaken your immune system and leave you open to diseases like cancer. It's critical that your stress is addressed. And if your stress is not something that you can leave for some reason, like let's say, you know, some people are like, yeah, okay, great. Maybe I can get a new job. Maybe I could leave the relationship. And I encourage you to do so if it's very toxic, because that is something that, you know, no blueberries or raspberries are going to help if you're dealing with that kind of stress. But for some people, there's truly stress that they cannot escape. Like caring for a loved one that cannot care for themselves. There's nothing you could do. It's not like I could say, you know, leave that person. So for some of you listening, you might be like, there's no way. I have this chronic stress in my life, and there's literally no way that I could walk away from it. True. But you still can manage the stress by using meditation, hypnosis, because I need you to understand that stress is just going to be the fuel that just sets this fire higher. And we have to manage it. We have to talk about it. We have normalized stress. We've made it feel like we wear it as a badge of honor. Like, I'm so stressed. I have so much on my plate. But when you're dealing with a chronic issue, it is not the time for that badge of honor. It is time to figure out either how to remove yourself from the stress, from the toxic relationships or the toxic job. Or if you can't remove yourself from the stress because this is something that's in your life, finding ways to manage the stress with, I'm just saying, meditation, yoga, deep breathing. There's other ways to do it, but it has to be on your list of priorities. So let's get that there. Okay, I'm moving on. I really hope I've impressed that upon you. And I just want to let you know this is truly chemical. Like there's when you're stressed, neurotransmitters are released like norepinephrine, and they stimulate cancer cells. So when I'm talking about stress, it's not just, you know, this theoretical emotional thing. It is literally changing chemicals in your body that will worsen the disease. Okay, so I'm going to move on now to the next topic, which is movement. And movement is important. And again, one of those things that many of my patients leave lower on the list. They'll do the diet, they'll put on this, they'll take the supplements, but they're like, I don't know if I want to exercise, or maybe they get to it and it's lower. And I get it. And making these changes are hard, so no judgment. But I want to take a moment and explain to you how important it is in relationship to cancer. So we have the fact that just by moving, it helps control your weight, reduce insulin levels, reduce insulin resistance, and which strengthens the immune system. A study, I just want to read this for you, a study from the American Cancer Society and National Cancer Institute found that leisure time physical activity was associated with a significantly decreased risk of breast cancer, colon cancer, esophageal cancer, liver cancer, stomach cancer, kidney cancer, myeloid leukemia, and physical activity was strongly associated with a decreased risk of multiple myeloma, as well as cancers of the head, neck, rectum, bladder, and lung. So this is not theoretical. This is not like, hey, if you move, you'll feel better. We're talking about reducing risk of cancer just by movement. So it needs to be on the list of things that you do. It cannot be low. It has to be high up there. If this is something that you want to reduce the risk of, we have to get moving. Now, for the people who have cancers, movement reduces the risk of recurrence by 50%. That's huge. Now, how much movement is debatable and really depends on the patient. So there are some people who say, 30 minutes of a brisk walk 5 days a week is good enough. If that's your max, then yes, do that. But if that's not your max, or that doesn't kind of get you to that cardiovascular edge, then you might need to do a little bit more. So how much is debatable on your starting point and your goals, but movement is critical when we're talking about minimizing risk. I would be remiss if I didn't take a moment to talk about toxic burden. Now, I'm not going to spend a long time on toxic burden because that's a whole talk by itself. But I do have to say, in a moment, we're going to talk about nutrition and we're going to talk about supplements. And of course, they are major factors. But we have to talk about our environment and the toxins around us. So we know it's in our air, and it's in our water, it's in our foods, and there are a lot of things that are invading our environment on a daily basis. And you might go to a functional medicine provider to help remove those if you need to. And I don't want to get into it now, all the toxic burden, but I have to mention it as part of our risk for cancer. And we'll do a whole live on that another time. Okay, so we talked about stress. We talked about movement. We talked about the toxic burden. It's time to talk about the big thing, which is nutrition. Nutrition is the big thing. What we put on our plate is the most powerful thing. It is the medicine. Food is medicine. I know it's a sentence we say, but it literally is. And for those of you who maybe don't get it, it doesn't resonate with you, think about it. If you take a pill through your mouth and it does all these things in your body, why would you not think that if you put food in your mouth, it's going to do all these things in your body? It's the same point of entry. Putting it through your mouth, it's going to have an effect. What's on your plate is as effective as any medicine out there. So nutrition. Our bodies, I don't know if you know this, but our bodies are producing precancerous cells all the time. But not all the precancerous cells become invasive cancers because our bodies have a way of getting rid of them. And that's where lifestyle has a big impact. In this moment of, is this cell going to become cancerous or not? Do I have the tools inside of my nutritional toolbox to help me prevent these precancerous cells from becoming cancerous? So the first thing I recommend, always anti-inflammatory diet with a focus on vegetables, nuts, seeds, olive oils, some animal protein, but most importantly, a severe limitation on sugar and carbs. We're going to talk about sugar a little bit more in a moment. But we have to stop the inflammation because inflammation is a trigger for disease, including cancer. Now, when we're talking about inflammation, we have to talk about obesity because obesity causes inflammation. I'm going to read this to you. The American Society of Clinical Oncology has estimated that obesity is going to overtake smoking as the number one cause of cancer worldwide. Hear me out. Hear this again. Obesity is going to overtake smoking as the number one cause of cancer worldwide. just by being obese, you have a higher risk of cancer, more than if you're a smoker. That is powerful. We need to know that if any of you are dealing with obesity and weight, this is not a conversation of how beautiful you are. You're gorgeous. This is a conversation of lowering your risk for disease, including cancer. Obesity increases inflammation in the body, increases insulin resistance, and is the driver for so many types of cancer in the body. So it's really something I want you to put high on your priority list. Sugar. Sugar, sugar, sugar. I know it's delicious. Who doesn't love candy? But it turns out that cancer cells also love sugar. Insulin promotes the growth of cancer cells. It doesn't just promote the belly fat. It doesn't just make us, look a certain type of way. It actually promotes growth of cancer cells. Cancer cells need carbs and sugar to grow. And if you shut off that supply, guess what happens? They can't grow. We know that excessive eating causes a lot of cancer-producing systems in our body. And we know that excessive eating causes inflammation, which also produces the systems for cancer. And then we also know it creates insulin resistance, which again is inflammatory, but it's also just feeds it. It literally feeds the cancers. So anything in your mind that you are thinking nutritionally that has to do with, how do I prevent diabetes? How do I not get diabetes? That's the same kind of nutritional advice that I want you to have when you're thinking about how to prevent cancer. And of course, I have to talk about fasting. And I did a whole live talk about it. If you haven't watched it yet, find my intermittent fasting live because it's awesome. I won't go into all the details now, but generally speaking, fasting is just a time when you're not eating. And when you're not eating, it's an amazing time for your body. It's an amazing time for your health. It lowers inflammation. It lowers oxidative stress. And it just shows not only to help with longevity, but it just helps with, again, reducing the risk of cancer. I don't want to go too much into fasting. I have a whole 3 more paragraphs on it, but I'm going to cut that short here. Go check it out on my fasting live. But I do want us to talk about supplements because everyone asks what supplements I could take. And I always want to remind you, supplements are not instead of. You have to do the work. You have to do the moving. You have to reduce the stress. You have to figure out what's on your plate. You can't possibly hope to pop some vitamins and think it'll all work out. It's not going to work out. Remember, functional medicine is not about, what pill to take. That's conventional medicine. This is about getting to the root cause and fixing it. So when I talk to you about supplements, I want you to know it's just part of this complete breakfast. This is definitely not something you could just take and then just keep eating the way you used to eat. So let's talk about supplements. Vitamin C, CoQ10, omega-3 fatty acids, that just has to be part of your normal everyday routine for so many reasons. For detoxification, you want glutathione. Glutathione is given in IVs. It's given in IVs in our office, but it also can be taken orally in the form of NAC. Minerals, zinc, selenium, and of course, vitamin D. There are 3 things I want to take special mention of in addition to this list. So there is something, when there is a tumor, there are chemicals that can help limit the tumor growth. A tumor has chemicals that create its own blood supply and allows it to grow. So there are certain things, there are medicines out there, but there are also supplements that try to shut down that blood supply so that the tumor doesn't grow. One of the supplements out there is called wormwood, also known as artemisia, and it's a compound that can suppress the chemicals and limit tumor growth by eliminating the blood supply to the area. Something to consider as you put together your supplement toolbox. Black raspberries are worth a mention because they can make precancerous cells in the esophagus and colon less likely to progress into cancer. So add in some berries, raspberries especially, every day. What do you have to lose? Nothing. Beautiful thing is, if it doesn't work, all you did was have some berries. No side effect on berries, unless of course you're allergic. Please don't have them. And the last thing I really want to mention is green tea. Green tea has so many amazing effects, but one of the components in green tea is called EGCG. And one of the things that it does is it can prevent precancerous cells from becoming cancerous. So these are supplements that we want to have in our life: the vitamin C, the glutathione, black raspberries, and green tea. So now it's time for my favorite part, which is the recap. because if you don't know by now, you need to go on your iPhone and look up your GIFs or your GIFs and type in the word recap, and you will see my face doing this. So recap away. Here's the bottom line. We now know that over 70% of cancers are influenced or caused by our lifestyle. That means that there's so much in our hands that we can do to decrease our risk. There's so much. This is a powerful message that we can do things to decrease our risk. We don't have to sit back and just accept it. So reduce your stress, get moving, pay attention to the toxin in the environment, change your diet, add the right supplements, and take control of your health and make your body an unwelcome place for cancer. And if all of this is confusing and you need to, reach out to us, you need a guide, you can work with us. And the way to reach us is at The New Method on just about every platform, or thenewmethod.com. Message us, email us, anything you want. We're here to help you become the game changer in your life, because you always knew there was a better way. I will see you guys next week. I hope you found this video on how to make your body an unwelcome place for cancer really informative. And if you did, don't forget to click like and subscribe. If you like it, check out last week's video on inflammation. Bye.